Taking my fundamentals HESI on Thursday. Is there any tips you have to share, please? Okay, some tips I would share. If you are going into the nursing program or you're already in the nursing program and you know you have a fundamentals HESI ATI exam coming up, some things I would strongly encourage you to strongly encourage you to know. This is going to be a long video, by the way, so save it so you can take notes later. Know where to place the stethoscope if you want to listen to the S1, S2. Make sure you know the difference between Medicare and Medicaid. Make sure you know the steps to catch a midstream urine specimen. I would know how to apply antibiotic ointment. I would know nursing math. You have to know your dosage calculations. I would know what the DNR is, how that's applied in certain situations. Informed consent. If I were you and I'm taking Fundy's HESI, I would definitely have to know informed consent. Who can give informed consent? And I'll give you example. Someone who's underage but they're married, or someone who's underage but they've been I'm using the wrong word. I was about to say exonerated. That's not the word I'm using. I can't think of the legal word, but basically they can act as an adult. I can't think of the word. Somebody say in the comment section for me. Someone who's underage, but they're legally married in that state. Someone who they could be under 18, but they're in the armed forces, or someone who is under 18, but they have a child. They can give informed consent for their child, but they can't give it for themselves just because they're parents. So informed consent, you definitely need, I would encourage you to know. When would you use a lead container with long-handled forceps? So for example, if your patient has a radiation implant, I think that's important for you to know. If a patient has a respiratory condition, how are you going to position them? You know, any patient that can't breathe, you're going to do what? Set them up. I think that's important for you to know. It's important for you to know the location of organs. If you have to do a point and click, if they mention the gallbladder, can you take that mouse and point where you expect that gallbladder to be located? Risks for delirium. Okay, you need to know the difference between, I would think you need to know the difference between delirium and dementia, right? With dementia is long-term, it's progressive, there is no cure. Delirium is short-term, it's acute, and there's an underlying condition. So once you figure, not you, the nurse, but once it's been figured out what that patient's underlying condition is, you expect the delirium to go away. So I would expect you to know the difference between delirium and dementia and risk of delirium. Lab values. If I were you, I would know the lab values and what it means. So the patient that has hypercalcemia, what would their lab value look like and what clinical manifestations would I expect? You need to know the most dangerous lab values if they're out of normal range, which is going to be your potassium. Potassium will kill you in a minute. And also sodium. So if you can't memorize all of them, make sure at minimum you have potassium, hypokalemia, and sodium, hyper and hyponatremia. But make sure you know all of them and those clinical manifestations. If I were you, I would know foods high in potassium, because there are certain medications that the patient takes that they cannot have foods that are high in potassium. So I would know the foods that are high in potassium that the patient would need to avoid. You need to know the difference between the potassium sparing diuretics and the potassium losing diuretics. I think you need to know, back to the lab values, one of those things are your WBCs. If the WBC count is high, you know WBC is supposed to be 5 to 10,000. If it's over 10,000, what does it mean? What are your nursing interventions going to be? Epistaxis, patient has a nosebleed. What are your nursing interventions for that? What are you going to teach the patient about that? What questions are you going to ask? So, for example, if it's a pediatric child, parents are freaking out. One of the questions, does the child pick their nose? Why? We know one of the reasons we tend to see nosebleeds in children is they like to pick their nose. Make sure you know about that. I talked to you about hypokalemia already.